We're going to go ahead, as their standard practice is to give all these patients a 1-month monitor for AF, an AF monitor. I don't think there's any better way to start off the workup of a patient with palpitations who you think has a high likelihood for AF. These algorithms work very well. And some of them were what some people call this micro AF, or short bursts of SVT, 15 seconds, 20 seconds, looks like an atrial tachycardia. And if it lasted longer, you'd probably call it an episode of AF. And maybe we'll ask you, Jared, to talk a little bit about micro AF and what you think, where it belongs in the disease classification. But what are we measuring? So monitors are useful because, as Jared pointed out, you can correlate symptoms with recurrent arrhythmias. They may be useful for clinical decision making, and I'm going to make an argument that the current guidelines are inadequate because they don't build in any measure of burden of AFib in determining what your risk of AFib is.